Hello everybody, it's Colleen from Let's Talk About It. Today I want to talk to you about TMJ diagnosis and treatment. So as you know, I have vestibular migraines and I have occipital neuralgia and post-concussion syndrome from a car accident. So what happened to me, I'm in a car right now, is that the airbag that deployed on the side here hit me very, very hard, and it resulted in some head injuries and also hit my jaw. I remember actually after the accident I was having trouble speaking, but we really spent a lot of time on my head injuries and things like that. So I did have therapy 2 years ago on my jaw, but with the vestibular and all that, we just kind of put it aside. So I saw a new doctor. His name is Christopher Perry and he's in Woodbridge. I'll share the information with you in a minute. Excellent. I would highly recommend. So anyway, we did one day where we did a lot of evaluating of what's happening with my jaw. So it's really interesting, a lot of, feeling into different sensitive areas and kind of numbering 1 to 3 what the pain level was. And that was both outside all the way up to my temple and inside. So it's really interesting. I learned a lot from Chris about the anatomy of the head. There's muscles up here in your temple that actually come all the way down here and kind of hold your jaw up. So I didn't break my jaw, thank God, but I significantly damaged it. He said my muscles are so super crazy tight and spasming, and that's what's causing a lot of the pain that I have. So one of the first things we did is he had a sneaking suspicion, and was correct, that I clenched my teeth. And it was interesting today. I asked him, I'm looking for the thing he gave me. I asked him, do most people have TMJ issues from accidents? And he said no. He said a lot of it is from stress, clenching teeth, grinding teeth, things like that. So anyway, right then and there, on the first day I saw him, he made me this, I think it's called a quick splint. That's what it's called, quick splint. So it actually molded. It's a little piece that goes in my mouth. It's actually molded. I look like a boxer. Anyway, it keeps me from clenching my teeth. So I wear this at night, or, even if I'm just driving and not talking to anybody, I'll wear it. And the concept is that for 2.5 years, I've had really tight spasming muscles, and then I clench my teeth, which is going to make them never relax. So it's really going to impede my healing, which is where I am right now, 2.5 years out from this accident. So yeah, it's kind of cool. It's like molded right to my teeth. Eventually I'll have a more permanent one. He also thought that maybe I should look at getting a sleep study, which I'm going to do. I did have sleep apnea years ago, like in 2010, but I lost a bunch of weight, so I just figured it was gone. But he thinks I probably should get that looked at because, if you're going to have a lack of sleep and all of that, that's going to affect your healing as well. So, we need a whole body approach to making sure that we're, healing in a good way. So today I went back for my follow-up, and we talked about a different kind of treatment, and that included Botox. So again, because these muscles they're very, very painful to touch. In here, I don't know what the name of this muscle is, but there's a big one in here. So what we did today, we had a long talk, evaluated me some more, and then we talked about treatment. So for me, what we're going to do is, what we did do is Botox injections. So I had several units put in here and here, both sides, and also all in here in my temple area, and even like back here and behind my ear. It's quite painful. Different areas he touched, it's shocking. It's shocking to think, okay, I hurt my jaw, but really all these other muscles and ligaments have been affected by my accident, and those affect how my jaw works. So it's pretty interesting. So we did do, I don't even know how many injections, but several here on both sides. And I think some numbing agent, which really is helpful because my whole head hurts now. So that's what we're gonna do. Typically you do, 2 or 3 maybe Botox treatments per year. What I would like to do also, we talked a little bit about like physical therapy and dental modalities, including like the use of ultrasound and different kind of massage techniques. So I want to see if I could find, it's very hard to find, I guess, but I'm gonna try to find someone who could do those kinds of things, cut down the inflammation, relax the muscles, deal with some trigger points. I don't know. I know that Dr. Chris said that he has somebody like that down at his Texas office, and he's going to look for someone in this office. So I'm going to share with you his information. If anybody's looking, Perry Dental. I'm going to hold this up. Hopefully you can see. I don't know if it's backwards. Might be. But that's his information, and I'll put it down below in the description as well if anyone is interested. So yes, he's a dentist, but he really specializes in TMJ diagnosis and treatment. Sadly, I'm gonna have to fight insurance again, because apparently insurance does not cover Botox for TMJ. They don't cover a lot of things for TMJ, which is, again, ridiculous. If you've been following my story, you know, I had to fight for 11 months to get my occipital neuralgia surgery that they kept denying, based on an exclusionary policy from 2005. So they hadn't changed their policy in 20 years with all this new research, and it's just ridiculous. So here we are again. Dr. Chris was really great. He's allowing me to kind of pay as I go. But yeah, the Botox for me right now is completely out of pocket. And he is out of network for me. So, you know, that's going to be 20% cost to me. Of course, it would be great if I had some settlement money, but the lawyer takes a third, and my insurance company took a third of my settlement, and the rest had to go to my pension. So I really have nothing from my accident that destroyed my career, and I'm still 2.5 years getting all this stuff done, and now, you know, especially something like this is out of pocket, which is ridiculous. So I'm gonna fight the fight, you guys. We'll see what happens. It's probably gonna take me a year, but I will do what I can to see if we could somehow get them to not exclude treatments like this, especially if it proves to be effective. He said it should kick in about a week, and then I'll see what I'm dealing with. I did have the whole Botox procedure on my head 3 or 4 times. It only lasted 2 weeks for me, so for me it wasn't worth it to do the Botox from my head, but we'll see. Anyway, if anybody thinks they have TMJ, again, it could be clicking here, it could be pain all along here. I mean, I may have trigeminal neuralgia too, which kind of is also in these areas, but you know, the clicking, if you have your bite is affected, if you have pain here, or up in your temples, I would highly recommend Dr. Perry. So thank you, and I will keep you updated on how we do with these Botox. Hopefully I'll look 10 years younger. We'll see. Bye.